It was a pretty humble beginning. I was a kid in high school, like a lot of kids in the 70s and early 80s. Didn't quite know what I wanted to do, and figured I'll be a nurse. I had no healthcare people in my family, so it was a bit of an off the wall choice for someone in my family. But I figured I'd be well suited to it because I really enjoyed working with people. It did turn out to be a great choice for me. I really enjoyed working with people who were vulnerable. I started my career working in the cancer space with patients who had leukemia and lymphoma and needed bone marrow transplants and needed chemotherapy, et cetera. And so I do actually credit that first job with giving me a very solid appreciation of life and the contributions that I think all of us have the potential to make, as well as obviously work ethic and everything else. So as I progressed in my career, I tried a few different things. I was a clinical educator for quite some years. I enjoyed teaching. I enjoyed mentoring and coaching new people, and then soon realized that actually I thought when I watched the frontline managers, I thought, you know what, I could do that. I'd like to do that. I'd like to take a coaching approach to healthcare administration instead of a more hierarchical kind of dictatorial approach, which was kind of the common thing back in those days. And so I went back to university, got my degree. In those days, nurses didn't need to have a degree, a diploma was enough. And I got my first managerial job at Vancouver General Hospital. Loved being a manager. Had over a span of several years, was manager in surgical oncology areas, in medical oncology, in solid organ transplant, in short stay surgery. And so I had a range of experiences. And it was at that time where I really knew I'd found my niche. I loved administration. I liked making change. The system can be incredibly hard to change. And so sometimes it's small incremental changes you can have, but I loved to have impact. I like to see, the staff grow. I like to be able to spot the stars and be able to really facilitate their development. And so I was at Vancouver General, which then became Vancouver Coastal Health for 19 years, and decided it was time to get out of my comfort zone because I'd been there ever since I'd graduated, and moved to Fraser Health. And that's when I started to understand what really running a whole hospital was like, as opposed to one program or service. And when I first started, I had responsibility both for hospital administration, but also for public health in that area. And that was really new to me because I'd always been a hospital nurse and a hospital manager. It gave me a huge appreciation of how important system integration is. The hospital really is only one very small part of a patient's journey through the healthcare system. The big parts actually happen in the community. They happen in the family practice space, in the prevention space, in the home care space, long-term care, et cetera. So it gave me a good appreciation of that. And soon after that, I went into really big administration and became a vice president in Fraser Health. And I had responsibility for 13 hospitals across Fraser Health, which is a very large health authority in the suburbs of Vancouver. And I also had responsibility for all public health services within that area. So that was around a $1.5 billion budget. And a great span in terms of geography. It went all the way from Burnaby to Hope. So lots of driving around in that job. We did a lot of reorganization during that time. We moved to a system called program management, which meant that it was intended to get the hospitals working together much more synergistically. by aligning programs between hospitals. So, for example, the emergency was one program across 13 hospitals. Surgery was one program across 13 hospitals. And that was really to avoid competition, to make sure that we had consistent policy standards, quality of care, that big sites could really help small sites in different ways, and that we didn't have bottlenecks at some sites and capacity at other sites. So that was really important, and I was a big proponent of that change, and we made that change over that period of time. And then after about 7 years at Fraser Health, I moved to PHSA, which was the Provincial Health Services Authority. And that gave me, so I had kind of gone from being a middle manager in a hospital to understanding a hospital system to moving into the provincial realm. And so that I felt was important for my own development, in that it was kind of growing in scope and span and authority. And at PHSA, I had responsibility for all of the delivery agencies, of which there were many quaternary agencies in that: the provincial cancer system, women's and children's hospitals, the BCCDC, and also mental health services. And then I had responsibility for what we call commissioning agencies. So those were agencies where PHSA didn't directly deliver the care, but they held the funding and they commissioned the health authorities to do it. So things like cardiac care, renal care, um, uh, transplant, those kinds of things. And then I also had responsibility for what we call the planning agencies. So those were agencies where they didn't deliver money, they didn't deliver services, but they really helped to set quality standards across the province for a variety of things. So, for example, something like Child Health BC, which set standards for pediatric care across the province, regardless of what health authority you were in. So that was really broad experience, and an opportunity came up to go to Ontario. My husband became a vice president at Sick Kids, and so we decided our kids were grown up and almost grown up, and maybe it was time for an adventure, because I was a BC girl, he was an Ontario guy, and we thought, let's try this. And it was actually really fun for me to go back to running just one organization as opposed to multiple. It gave me the opportunity to really get to know staff at the front line again, our physicians, um, our to build a new team. Ontario was really changing at that time and trying to dip its toe into integration. And so we developed Ontario health teams over that period of time, and some innovative programs. So that's kind of where I came from. It was, I would say, a very opportunistic type of pathway. I had never, ever, as a nurse, thought, oh, I'm going to be a CEO someday. Never crossed my mind. All I did was try to do the very best job I could in the position I was in. And when I felt like I was ready for a new opportunity, I took chances, and I sometimes took lateral moves in order to learn more stuff. But always through, I would say, the thread running through everything was, this decision making around, will I learn something? Can I contribute something? And can I have impact? And I think that's sort of what has guided my career.